So if you're listening to this lecture, that means you've reached the end of the course. This is the last of the anatomy lectures for the Introduction to Human Anatomy course. We will spend a bit of time just introducing the male anatomy and the female anatomy separately, and with each of those we'll talk about kind of internal anatomy and external anatomy. When we get to physiology, we'll talk a lot more about the function and the processes that happen. I'll briefly mention those as we go along to give you some context. So, in the beginning, for all of us, in all of our beginnings, there were gametes. So, gametes are basically the male and female reproductive cells. So, these are the cells that need to come together to form other humans. And so the male gamete is called sperm, and the female gamete is called, commonly called an egg. Anatomically, it's called an oocyte. And most people pronounce it oocyte and not oocyte. So the gametes, a sperm from your father and an oocyte from your mother, join together. And once those two gametes come together and form one new cell, that new cell is called a zygote. And the process by which two gametes come together and form a zygote is fertilization. Or again, kind of commonly we call that conception. So here at the moment of fertilization, you have half of your genetic information coming from your father and half your genetic information coming from your mother. And at that moment, is the first time that you have your full genetic code all together in one cell. And so essentially, everything that you will become is already present and available in this single-celled zygote. And from that single-cell zygote, you will begin to replicate, divide, and form multiple tissues. Once the zygote divides and multiplies, it eventually forms an embryo. And so what we typically say is the zygote is the first few days of cell division. So it starts as that single cell. It turns into a blastocyst, and there's other stages it goes through that we're not going to cover here in this course. But basically, as long as it is still kind of floating and has not yet implanted into the uterus, it has not become an embryo. So the zygote would be that first kind of single cell, full complement of genetic information. The embryo is going to be, once that cell has begun to replicate, divide, and turn into numerous cells, it's going to travel to the uterus and eventually implant. Once it implants in the uterus, we call it an embryo. And then the embryo will continue to replicate and divide and grow and form new tissues. And we call that then a fetus. And the fetus, eventually, when it has reached maturity, hopefully, will be delivered, and once the fetus is delivered, we call it an infant. So when it's inside the womb, we call it a fetus, and when it is delivered outside the womb, we call it an infant. All right, so where do the gametes come from? The gametes are formed in the gonads. So the gonads is kind of a generic term for male and female reproductive organs, which produce male or female gametes that are needed for reproduction. So commonly, we know the names of these gonads, even if you didn't know the term gonad. You've heard of testes and ovaries. So if we're referring to both of the male gonads, we use the word testes. If you're talking about one, you can either say testis with an I, or you can say testicle. Ovary or ovaries for plural. And the gonads don't only produce the sex cells that eventually come together to form the zygote, but the gonads also produce hormones, and these hormones are important for reproductive cycles for sure, but also for expression of external sexual characteristics, such as breast development or scrotum and penis development or terminal hair development, building muscle mass in men, and thickening of vocal cords, which leads to a deeper voice. All of these are really under the control of these sex hormones, which are produced in the gonads. Okay, so in addition to, we're talking about kind of the general structure or overview of the reproductive system. So the gonads are kind of the center because they're the ones that are producing the sex cells and the hormones. But both male and female reproductive tracts are going to have portions of it that are storing and transporting the gametes. And that's kind of what we call the tract part, the part that's either holding or storing or moving these gametes so that you can continue the species, so that you can unite a sperm with an egg. In addition to the gonads and the reproductive tract, there's also accessory glands that are going to produce fluid, especially in the male, in order to kind of nurture the male gametes, and also to help get those male gametes to a female egg or oocyte. And then we'll talk about the external genitalia as kind of what you can see with the naked eye. This is just a picture, by the way, of an oocyte, of what a female egg looks like. Okay, but we're going to start with the male anatomy, and we'll start with the gonads. So in the male, remember, the gonads are called the testes. And what's interesting about fetal development is that, at a very early stage, we are neither male nor female, anatomically speaking, when we're an embryo. At some point, if you have a Y chromosome, that Y chromosome will produce testosterone, and the testosterone will then trigger a series of events that leads to the production of male anatomy. And so initially, the precursors to testes and ovaries are kind of a gender neutral kind of organ, but under the influence of testosterone produced because of the presence of a Y chromosome, that kind of generic gamete will become a testicle or two testes. Okay, but the problem is that those testes are still in the abdomen, because if there was no testosterone, because there was an absence of the Y chromosome, so if you're a female, you have two X chromosomes, in which case you don't make the testosterone, and so those gametes become eggs. And for a female, you want the eggs to remain in the abdomen. And that makes sense for a female, really, to have your gonads internal, to have them protected inside the pelvis. Especially for women, their ovaries are kind of deep in the pelvis and protected by all of those pelvic bones. That's actually a good idea, because that causes, it allows for great protection, so you don't harm the gonads, you don't harm the eggs. In a male, however, in order for the gonads to function properly, in order for the sperm to develop and survive, they need a slightly cooler environment than what is found inside the abdomen. So the testes cannot stay inside the abdomen. If they do, it's too warm and the sperm cannot survive. So the testes have to move from the abdomen to the outside of the body, into the scrotal sac. And it does that during fetal development. So as you're looking at the picture here, you can see that you've got a testis here that's inside the abdomen. And it eventually needs to get down here into the scrotum. So it's going to move its way down, and here you can see it reaches a ring, almost like a hole on the inside of the abdomen, kind of down low, kind of just above your groin. And it enters through that we call inguinal ring. And then once it gets, so that's how it leaves the inside of the abdomen and moves out. And then once it goes into that ring, there's kind of like a little tunnel that the testicle can then descend into the scrotum, and that's where it will stay. So you can see that the testicle is moving both inferior and it's moving anterior in order to get to the scrotum. And it has to pass through that inguinal ring and then down the inguinal canal and then eventually descend into the scrotum. This is one of the reasons, and maybe I'm going to mention this later, but I'll just mention it now because this is a good picture for it. Men are more susceptible to having inguinal hernias, a hernia that actually causes abdominal contents, whether it's fat from the omentum or whether it's actual small intestine, to kind of slide down into the scrotum, and it follows the same route as the testes do. So that internal inguinal ring eventually, kind of patches itself, but it always remains a little bit weaker than the rest of the abdominal wall. And so if you have a lot of abdominal pressure because you are lifting a lot, for example, and increasing abdominal pressure regularly, you may actually wear through that patch and cause that ring to reopen. Once it's open, the tunnel or the canal is still open, and so bowel that's in the abdomen can go inside that ring and then down into the tunnel and then down into the scrotum. And this is a pretty common problem for men, but not really for women. They don't get this kind of hernia; they get other kinds of hernias because women don't have that same problem because they didn't have testicles that needed to descend. But in men, that becomes a problem. All right, so that's the gonads. If we look at kind of coming up from the gonads, so now we're looking kind of externally. We've cut away part of the scrotum, so you can see the scrotum here. We've cut away anteriorly so that you can see the testicle on either side. So if we look on this side here, you can see that coming kind of leading to and from the testicle are a series of tubes. Some of them are blood vessels, veins, and arteries. Some of them are lymphatic vessels. Some of them are nerves. And one of these tubes here, the white one, is actually part of the reproductive tract that carries the sperm from the testicle into the urethra so that it can be ejaculated. The kind of combination of all of those tubes together, the tube that carries the sperm, which is called the vas deferens, the blood vessels, the arteries, the nerves, the veins, they're all kind of grouped together into a cord, and we call that the spermatic cord. And there's one on each side. So that also, those cords also run through that canal, which is the only way to get from the abdomen into the scrotum. And so because that canal stays open for the cords, sometimes bowel or omentum or fat from the abdomen also goes down into that canal and goes into the scrotum and causes those hernias that I was talking about. So you can kind of see, I think on this picture, a little bit more what I was talking about. So from the inside, you've got that inguinal ring that the spermatocord has to go through. But sometimes if you've got bowel in here, that bowel can also slide down into that canal and give you a hernia. All right, so the scrotum is kind of a sac, really, that just holds the testicles. And there's one scrotum, but it has two sides, and the two sides are separated by what we call the raphe, which is just kind of this central part. And then the testes themselves are surrounded by a membrane called the tunica vaginalis, which is located within the scrotum. And just like we talked about the pleura and the pericardium and the peritoneum, there are two layers here. There's one that's kind of on the inside of the scrotum, and there's one that's kind of wrapped around the testicle itself. So we have parietal and visceral layers, just like we did for pleura and pericardium. So analogous to the pericardium would be the tunica vaginalis. Okay, there are two muscles as well The dartos is just there to kind of keep the testicles a little bit higher, a little bit elevated. That's kind of more for protection to keep it a little bit closer to the body. Now remember, if it gets too close to the body, it heats up, and that excess heat kills the sperm or causes them to be inactive. And so we don't want to be too close to the body, but the closer we are to the body, the more protected those gonads are. The probably more important muscle is called the cremaster muscle, which you can see here. And on this side, you can see that the cremaster muscle is kind of all around that testicle. And when it contracts, it pulls the testes kind of up and in. And it's kind of a protective measure once again. So if ever the scrotum gets touched, for example, the cremaster will contract and pull those testes kind of up in towards the body as a protective measure. If it gets very cold outside, the cremaster will also contract to pull the testes closer to the body to make them a little bit warmer. So just as too warm a temperature can harm the sperm, so can too cold a temperature. So if it's cold outside, the cremaster muscle will pull the testes a little bit closer to the body to kind of balance out that external cold. All right, so here we're just kind of getting a cross section through the scrotum and the testes, and we'll go over some of these things that we mentioned. So you can see that the scrotum is largely skin. There's also the dartos muscle that we talked about. There's some fascia, which is just connective tissue that usually separates layers of muscle. So between the dartos and the cremaster, you have some fascia. And then you get into the inside of the scrotum, and this is where you begin to see the tunica vaginalis. Remember, there's two layers, right? There's the first layer is going to be the parietal layer that's really covering the inside surface of the scrotum itself, and then that kind of folds around and covers the testicle itself, and that gives you the visceral layer of the tunica vaginalis. You'll also notice we're starting to see this network of tubes. You see them all throughout. And basically, I mean, the majority of a testicle are these tubes. And these tubes are called seminiferous tubules, you can see over here. And the seminiferous tubules are kind of the functional area of the testes. Everything else is kind of supportive, right? We've been talking about muscles and nerves and veins and skin and tunica vaginalis. These are all supportive tissues. The actual kind of work, the production of hormones and the production of gametes occurs in the seminiferous tubules. That's where the work gets done. That's kind of the functional unit of the testes. And all of these seminiferous tubules will eventually kind of come together into one big tubule that leaves the testes and goes to the ureter. And that large tube is called the ductus deferens, and that's going to leave the testes there. In between the seminiferous tubules and the ductus deferens, there's kind of a convoluted tubule that carries the sperm from the seminiferous tubules to the ductus deferens, which we also sometimes call the vas deferens. You'll see vas deferens as well. And when men get a vasectomy, it's a vasectomy, so it's actually a cutting of the ductus deferens so that sperm can no longer get from the testicle to the ureter, and therefore the man becomes sterile. Well, in between the seminiferous tubules and the ductus deferens, there is a congregation of tubules called the epididymis, which tends to sit kind of superiorly on the testicle. Okay, so we talked about the tunica vaginalis. Beneath that is another layer of connective tissue called the tunica albuginea, which separates the testes into the lobules that we were looking at, those kind of separate sections. and the seminiferous tubules lie within those lobules and are producing the sperm. And then the seminiferous tubules connect to the epididymis, as we mentioned previously. All right, so if we looked down microscopically into the seminiferous tubules, remember, this is where the work is happening. This is where the sperm are being made. This is where testosterone is being made. So if we look down into a tubule and looked, microscopically, looked down at the tissue and the cellular level, this is what we would see. We would see sperm being produced through kind of a series of progressive maturation. So starting as a very kind of immature cell and going through a developmental process to become a much more mature sperm that's able to actually function as a gamete. And so that's kind of what you see going on if you look, for example, on this side, or you look along here and you see eventually they become what look like sperm, but it takes a process. And so that process is called spermatogenesis. Genesis just means the beginning, right? The first book of the Hebrew Bible says, in the beginning, and that book is called Genesis because that means beginning. And so spermatogenesis means the beginning or the origins of sperm. It's the production of new sperm, and that's stimulated by testosterone. The testosterone is produced by interstitial cells that are also down with the seminiferous tubules, or down in that area. Here's an example of some of them down here. And those interstitial cells are under the influence of some of those pituitary hormones like FSH and LH that we talked about. There were also nurse cells that you can see. These are these kind of bigger purple cells in the picture. And they just secrete substances that kind of help the maturation process of the sperm, that kind of help guide the sperm along. And so these kind of immature sperm that you end up with at the end, since they're not fully mature, we don't call them outright sperm. We call them spermatids. That's what that name means. We're not going to go through the process of meiosis in this course. If you take a genetics course, I'm sure they'll go through it, or maybe your basic biology course. And so some of you are already aware, but mitosis is how most of our cells divide, and they give us, you start with 46 chromosomes, and the new cell will be identical and will have 46 chromosomes. So that's how most of our cells replicate, divide. That's how new cells are made all over the body. Meiosis is when a cell divides into a new cell, but it only gives half of its genetic material. And that only happens in the gametes. Here is a microscopic view of what we were talking about. And so you can kind of see the series of the development of these spermatids. And then every now and then you see some spermatids. You can see the heads. They look different than the rest of the cells. And they are going from the outside in, right? Because eventually you want these sperm to be all kind of swimming in the lumen, so that when it comes time to reproduce, those sperm are in the tube and can be ejaculated. All right, so let's look briefly at the anatomy of the sperm itself, because it's a very unique cell. There's no other cell like it in the human body, and it's really the only flagellated cell, at least the only one that I can think of offhand, in the human body, the only cell that has a flagella to help it move. And so we call that flagella the tail. You can see back here. And it's actually quite fascinating and complex, that tail, how it's made, how it moves. It requires nearly 20 different proteins to all come together and work simultaneously in order to propel that sperm in the right direction. Then there is what we call a head on the other end. So tail on one end, head on the other end. Right next to the head is the neck. And in between the neck and the tail, we call the middle piece. Surrounding the head is a kind of protective layer called the acrosome. And that'll be important when we get to physiology and we talk about exactly how it is that the sperm and the egg come together to form the zygote. Right now, we're just kind of learning the anatomical. All right, so we looked at the gonads and the gametes. Now we're going to look at the reproductive tract. That's the part of the reproductive system in the male. Excuse me. That carry the sperm out to the urethra. So we've already talked about some of these. You have the epididymis, which transports the sperm from the testes to the ductus deferens, or the vas deferens. Then you have that would be, kind of down here. And so where the epididymis would carry it to the ductus deferens. The ductus deferens then is going to carry the sperm into the urethra. Along the way, it's going to kind of be, the sperm are going to be aided by various fluids that are produced from some glands. And the two primary ones are the seminal glands and the prostate gland, which you can see in the picture here. So those are the seminal glands there. And then the prostate gland is kind of a almost walnut-shaped gland that surrounds part of the urethra. And so all of these glands are going to secrete fluid, and that fluid is important, again, for the last bits of development and maturation of the sperm, for the health of the sperm. But it also produces a liquid for those sperm to swim in. I mean, if it was dry, the flagella would have, nothing to move, to whip through, to propel the sperm. So you need a fluid there so that the sperm have something to swim through. And so that fluid is largely produced by these glands. So if you move from the reproductive tract to the external genitalia, or the external male anatomy, we've already talked about the scrotum, which of course you see here. And then you have the penis, which is the main part of the male external genitalia. And we kind of split up the penis into three different sections. So the root would be, the part down at the bottom that's connected to the anterior pelvis and the scrotum. Then you have the body, or the shaft of the penis, which is most of what remains, except for the tip, which is different in color. It's more of a pink color, and we call that the glans. And then the kind of slit, or a hole where the urethra is able to dispense urine or semen, that's called the external urethral orifice. Now, in boys, when they're born, it doesn't exactly look like the picture. This is a picture of a circumcised penis. So the skin that's here, that's kind of overlying this part of the penis, the body of the penis, when boys are born, it actually covers over the glands as well. And so you can't see the glands unless you retract that foreskin, and the glands will be underneath. Well, in many cultures around the world, for cultural or religious reasons, that foreskin is kind of pulled out and then cut. And then after it's cut and you let go, it retracts and the glans is now visible. And we call that circumcision, when you cut the foreskin off of the penis and kind of reveal the glans. It's largely cultural or religious. There's been numerous debates for decades as to whether or not it's actually more or less healthy to have a circumcision. In the end, at least currently, it looks like from the evidence, it probably doesn't make a big difference one way or another. You may have slightly fewer urinary tract infections in men who are circumcised, but the rate of urinary tract infections is already pretty low for men, so it's not really a big benefit. Normally, when we're counseling parents, we really kind of present it to them as a cultural or religious option. So there's not really a medical indication to have a circumcision, but culturally in America, most men are circumcised. In other parts of the world, circumcision is not routinely done. Okay, in addition to kind of the external skin that you can see in parts, there's also a kind of unique internal anatomy to the penis, because the penis has to function for two things. One is for carrying urine, right, to allow us to excrete urine from the body, which is important. But it has to also function as a reproductive organ, and so it needs to be able to become stiff or hard, and so it has to have a special kind of tissue that allows it to remain soft most of the time, but then to become more stiff when reproduction is occurring. So there's special tissue in there that allows for that to happen. And there's 3 columns of tissue. I personally like this view to understand the columns. So this is a cross section through the penis. You can see that there is 1, 2, 3 columns of tissue. So there are 2 corpora cavernosa, that would be the purple tissue that you're seeing, and then there's 1 corpus spongiosum, which surrounds the urethra, which you can see. And so what's unique about these tissues is that when they are not flooded with blood, they're very soft, flexible, and flaccid. But when blood arrives to the area and fills, you can kind of see it almost looks like a sponge, right? When blood comes to the area through stimulation, and we talked about that was parasympathetic stimulation causes an erection, that causes this tissue to engorge with blood. And that blood increases the pressure, which then allows the penis to become more firm. And then, of course, that's necessary in order for reproduction to happen. So it's these special tissues, columns of tissue, that allow that to happen. Okay, so that was the male reproductive system. We're going to kind of go through in similar fashion in the female reproductive system. We'll talk about the gonads, the tract itself, and then the external genitalia. So if we look at just kind of the general structure of the female reproductive system, we can look at the main parts, and then we'll kind of zoom in on these parts as we go along. So this picture is good because it shows you pretty much all of the parts together. So you can start back here with the ovaries, which are these kind of purple oval-shaped structures. And then from the ovaries, we can come into the uterine tube, or what's often called the fallopian tubes. And then the fallopian tubes connect to the uterus itself. The end of the uterus, or the tip of the uterus here, is called the cervix. And there is an os, or opening. So this is where, if sperm are ejaculated into the vagina, they will go through that os and into the uterus, and they have to make their way to the fallopian tube in order to catch an egg that has been released from the ovary, and they typically connect somewhere in the fallopian tubes. There are some ligaments that you can see there that kind of help hold the uterus to the abdominal wall, help hold the ovary to the uterus and the fallopian tubes. So it's quite flexible to allow for movement. So, when women are driving in a car, or are running, or are turning over in bed, or doing backflips, or there's a lot of movement that goes on. So you want to have flexibility without causing damage, but you also don't want them free floating. That would actually probably cause more damage. So you want a system of support that's flexible but still kind of holds things in place, and these ligaments do a really good job of that. Okay, now we'll take some time and go through these parts individually. Here's a kind of a gross anatomy picture. If you took a camera inside the abdomen, and let's say you went through the belly button and then you turned the camera inferior, this is what you would see. So you would see let's see if we can see the ovary. Yeah, there's an ovary. I don't think you can see the one on the right. You can see the fallopian tube. And then this larger organ here, this is the uterus. And the very top of the uterus is kind of rounded, and we call that the fundus. And we've seen that term fundus a couple of times in the gastrointestinal tract. Here we have the fundus of the uterus. So for example, especially for you nurses, when you start doing obstetrical exams on women, and you'll kind of feel their belly, and you'll feel for the top of the uterus, and then you'll measure that to make sure the baby's growing properly. What you're actually feeling for is the fundus of the uterus. And so we call that the fundal height. So that fundus is a kind of an important landmark. And you can see that the uterus is kind of in the middle. It's more anterior, that's for sure. Posterior, you're going to have the rectum down in this area. So you're going to have some bowel coming in and forming the rectum down there. So the uterus is anterior to the rectum. But what you can't see in the picture, you can just barely see this strip of tissue down here. That's the bladder. So the bladder kind of sits anterior to the uterus or on top of the uterus. So that locates the uterus between the rectum and the bladder. All right, so let's start with the gametes. I'm sorry, not with the gametes, with the gonads, just like we did with the male. So the male gonads were the testes, and the female gonads are an ovary. And it's interesting that they both have kind of this oval shape because they kind of started as the same structure, right? And one became a testicle based on testosterone presence, and the other one became an ovary based on the absence of testosterone. So the ovary is full of follicles. Follicles are just like little sacs of fluid, and those follicles are in different stages of development. The purpose of the follicle is to produce a mature egg, just like we talked about spermatogenesis, producing a mature sperm. The eggs, the oocytes, they also have to go through a process of maturation, and that process happens in the follicles. And so if you're looking at, so this here is the ovary, and if you look around, you just kind of see different follicles in there. You can see some circles here, you can see this one, you can see this follicle getting a little bigger, this one getting a little bigger. So these are just kind of the maturation process of follicles. And so at any one time, if you were to look at an ovary or do an ultrasound of an ovary, you probably would find a handful of follicles there that are just kind of producing mature eggs, and that's not unusual to see. The ovaries themselves, we talked about, are kind of held both to the fallopian tube above and to the uterus medially by different ligaments. The ovary is also surrounded by a tunica albuginea, just like the testicles were. The testes were. The inner part of the ovary is called the stroma, so that's pretty much everything you see on the inside. And the stroma is separated into a cortex and a medulla, and we've seen those terms before, like with the adrenal gland, for example. The cortex is always the outside, and the medulla is always the inside. All right, so this picture kind of gives you and now it's an artist's rendition, obviously, but it gives you an idea of what we mean by this maturation of follicles. So you have primordial follicles are very tiny. Those ones, for example, you wouldn't really see on an ultrasound. Then you get a primary follicle. So every month, one of those primordial follicles is triggered by pituitary hormones to begin to produce a primary follicle. The primary follicle matures, becomes a secondary, and then a tertiary, and then a mature. And eventually, the egg that's being produced inside that follicle is released. And that's kind of the purpose of those follicles, is to make and then release that egg. And that egg gets released in the middle of a woman's menstrual cycle. So if you have a 28-day cycle, on day 14, that egg would be released, that oocyte would be released. It is FSH, which triggers the beginning of the cycle. So FSH begins we talked about LH and FSH, right, coming from the pituitary. So FSH will go and trigger the formation of these follicles, kind of starts that process. And then LH will actually come and trigger the release of the egg. Now, once that process is going on, there is also kind of simultaneously some other cells within the ovary that are producing female sex hormones, primarily estrogen. So just like when we looked at the male side, we had some cells that were becoming spermatids, right, becoming sperm cells or gametes. We also had surrounding cells that were either helping those sperm develop or were producing testosterone, which was also aiding in the process. So similarly here, we have some cells, the follicles that are kind of working on producing mature oocytes, but we have other cells in the area that are producing estrogen. The primary estrogen is estradiol, so you'll sometimes see it called that. So I mentioned that LH comes and triggers the release of that egg. Once that egg or oocyte is released, now that follicle has to change. It has served its purpose. And so it's going to begin to regress. But before it does that, it's going to try and support the new embryo, the new baby that may have been formed, right? So it just released an egg for the purpose of meeting up with the sperm, forming a zygote, which then implants as an embryo. And that embryo will need some support through the production of progesterone. And so the follicle that eventually ruptured and produced released the egg, it's going to turn into something called the corpus luteum. And the corpus luteum is going to produce progesterone, which is going to aid the baby. Now, if 12 days go by and no embryo is formed, then that corpus luteum will become a corpus albicans, which is basically an inactive corpus luteum. Eventually, it gets kind of reabsorbed and retransformed into ovarian tissue. Excuse me. All right, so that was the female gonads. Now we're going to talk about the female reproductive tract. And we'll start with the uterine tubes, or what's often called the fallopian tubes, as I mentioned earlier. And so you have the ovaries here, and they're going to release an egg, and that egg is going to enter the fallopian tubes. The first part of the fallopian tubes is called the fimbriae, and that just kind of means finger-like, and you can see that there's like these little kind of floppy finger-like tissue. And it's kind of wide there, which is important because you want the egg to easily find its way into the uterine tube. So once it enters the uterine tube, there's an area called the infundibulum, which would be the first part after the fimbriae. And then you have the ampulla is next. You have the isthmus, which kind of connects that outer part of the tube to the uterus. And then you have just this last portion of the tube that kind of leads to the uterus, and we call that the uterine part, which makes sense. So you'll need to learn those 5 parts of the uterine or fallopian tube. So the purpose, of course, is to carry an egg that's released from the follicle, from the ovary, into the uterus. In order to move that oocyte along, in order to move it down the tube and into the uterus, your body uses cilia. So I had mentioned in the respiratory lecture that you have cilia in the respiratory tract that kind of move mucus up and out. The second place that the human body has cilia is in the female reproductive tract in the fallopian tubes. And similarly, they kind of move to cause that oocyte to move through the tube. All right, once we leave the tube, we enter the uterus itself, which is kind of the largest part of the female reproductive tract. And the uterus is basically a hollow muscle. It's largely composed, I mean, it's most of its mass is composed of muscle. And that's important because that muscle is going to be used to squeeze the baby out eventually. So you need a strong muscle to help aid in that. And as we mentioned, it is held together by numerous ligaments. I'm not going to make you learn the names of these. I put them there for a kind of completeness sake, but just understand that there are numerous ligaments. Kind of, we say ligaments. It's not a ligament like that connects bone to bone. It's really just a sheet of connective tissue that connects the uterus to the abdominal wall or to the ovaries or various places. Okay, the uterus itself is composed of 4 sections. We already mentioned the fundus, which was the top, and I mentioned the cervix, which is kind of the last part here. So most of the uterus is what we call the body, and then this short part that connects the body to the cervix would be called the isthmus. So those are the 4 sections of the uterus. When you get to the cervix, we will give the cervix its own kind of anatomy so that we'll see a few parts of the cervix in particular. So there is the, if you think about it, you're going to have a baby up here, right? See that cute baby? So you're going to have a baby up there in the body of the uterus, and it's going to have to get out. And so in order to get out, it's going to have to pass through the cervix. So that means there has to be kind of a hole or opening on the inside, and there has to be an opening on the outside, and there has to be a tunnel connecting those 2 openings. And that's kind of where all these names come from. So the opening in the beginning is called the internal os on the inside, and the opening on the outside is called the external os. So if you've ever, as a woman, if you've ever had to go in for a female exam, a pelvic exam, pap smear or whatever, what the doctor is looking at when he looks in through the vagina and looks at the back and sees the cervix, he is seeing the external os and this part of the outside of the cervix. So in between that is called the cervical canal. So in between the 2 os is the cervical canal. So this is what the doctor would see. If he puts a speculum into the vagina, you can see this is the side wall of the vagina. But this, what kind of looks circular, that's the cervix. And this kind of hole in the middle, that's the external os. So just imagine when a woman goes through childbirth, that tiny, tiny os, which is not even a fingertip's width at this point, has to open fully and allow a baby to pass through. That's quite a change that happens. Okay, we can also look at the uterine wall itself. There are 3 sections to the uterine wall, kind of like the heart, right? The heart is also kind of a muscular container that holds blood. This is a muscular container that holds a baby. And so there are 3 sections to it. There is the kind of the inside layer, the middle muscle layer, and then the outside layer. So the inner layer is called endometrium. If you remember, endo means inside, so that should be easy to remember. Metrium occurs with all of these words. So you have the endometrium on the inside. That's the part during the menstrual cycle that gets thick and then eventually gets sloughed off and bled out. The myometrium is the bulk of uterine tissue. It's the muscle. It's what gives uterine tissue its thickness. So you see here that most of this tissue is myometrium. Myo just means muscle. And then there's a kind of like a serosal layer to it, and we call that the perimetrium. Peri means surrounding, so the perimetrium would be the layer of tissue that surrounds the uterus. All right, so we were talking a little bit about the ovarian cycle, how it goes from a primordial follicle to a primary follicle and secondary and tertiary and mature, and then eventually gets released. Well, at the same time that egg is maturing in the ovary, there are changes that are occurring in the endometrium inside the uterus, and they're related to some of the same hormones that are being produced. And so what happens during that ovarian cycle is the endometrium is also beginning to thicken. So remember the point of all of this, the point of the ovarian cycle and the point of this endometrial cycle is to prepare an environment, prepare a home for an embryo and a fetus to implant and grow and survive and thrive. So it does that by kind of increasing the endometrium, making the endometrium thick. And so if we look, we'll start here at day 7, which is kind of after you've bled and you're kind of starting from scratch. You can see that the thickness of the endometrium, remember that's the inner layer of the uterus, you can see that that thickness continues to increase day by day by day by day. And that's so that if the woman becomes pregnant, you now have a nice thick endometrium that the embryo could then implant into and kind of form a placenta, and it can attach into that thick endometrium, and then it can begin to grow and develop normally. Well, if at the end of your cycle, if another 14 days go by after the egg is released and there's no baby, then there is some hormonal changes that cause that endometrium to slough off, and that's why a woman bleeds once a month. So it has to do with changes in estrogen and progesterone, and we'll talk more about how that happens when we get to physiology. Okay, lastly, we'll talk about the external female anatomy, and that's going to be broken up into the external genitalia and then into the breast, which is unique for women as well. So the female external genitalia, you can see all the primary parts here. This kind of roof of it that kind of overlays the pubic bones, we call that the mons pubis. There's usually a layer of adipose tissue in there for protection. And then we can kind of come down and look at the other external structures. So if you remember, in the male we had a scrotum. Kind of analogous to the scrotum would be the labia majora, which is this tissue here. So in a man, that tissue is the scrotum. In a woman, it's the labia majora. And then you have the labia minora, which is kind of just on the inside, kind of surrounds and covers the urethral opening as well as the vaginal opening. And then you have the clitoris here, which is really analogous to the male penis, and with the very tip of it being analogous to the glands. In fact, it even has the same name, glands, that you find in a male. The hymen is a kind of thin layer of connective tissue that partially covers, for most women, that vaginal opening. And then when a woman has intercourse, or if she uses a tampon for during the menstrual cycle, that hymen eventually gets torn through so that the opening becomes truly open. So on the picture you don't see the hymen because it's been torn away. Okay, lastly, just for completeness sake, we'll look at the breast real quick. External-wise, you see the nipple is the kind of very tip, and the areola is that darker colored tissue that surrounds the nipple. And that area is where milk is ejected from the breast. So the breast functions primarily to produce milk for the infant, and so it is full of lobules, mammary glands. Mammary just kind of means milk, right? So they're producing milk, and then those glands produce milk into tubes, and those tubes all come together at the nipple, which is where the milk will be ejected from. I'm not really going to make you learn all of these terms, just understand that there's mammary glands there, lactiferous ducts and sinuses. That term lactate, lactate, you've probably heard that refers to milk as well. So this was more for completeness sake so that you can see the anatomy, but don't worry about memorizing anything except the areola and the nipple, which you probably already knew those names. So, okay, please email me if you have any questions about this lecture. Since we won't really meet again to discuss, we will have class on Friday in order to go through some review for the final exam. So if you've watched this before, then you can talk to me in class. Otherwise, send me an email if you have any questions.